Thank you, Mr. President. Just a couple of things, and then I just want to make a comment about something that happened yesterday. You're going to hear from Dr. Birx soon about the numbers that we've been talking about, how things are starting to balance off. And I think the more as we go by each day, I think we're going to see, and again, I never like to get ahead of myself or of Dr. Birx, but it looks like even though we've had a really bad week last week, remember when I was speaking to you before, I was saying this was really a bad week. There's still going to be a lot of deaths, but we're starting to see in some areas now that kind of flattening, particularly in a place that was a hot spot like New York. That's the first thing. The second thing is that I had a really very, very productive conversation with the Congressional Black Caucus this morning for about an hour, and they really wanted to know what exactly are we going to be doing in the immediate as well as the long range about the health disparities and the discrepancies both in infection and in poor outcome in the minorities in general, but specifically African American. And I mean, I made it very clear to them that what we have to do is focus on getting the resources where the vulnerable are to be able to get testing done, to be able to get the appropriate identification where proper and where appropriate to isolate and contact trace if we can, but also to help mitigate in a community that is suffering and suffering much more disproportionately. So I just wanted to get that out of the way. The other point I wanted to make is that I had an interview yesterday that I was asked a hypothetical question. And hypothetical questions sometimes can get you into some difficulty because it's what would have or could have. The nature of the hypothetical question was if, in fact, we had mitigated earlier, could lives have been saved? And the answer to my question was, as I always do, and I'm doing right now, perfectly honestly, say, yes. I mean, obviously, if mitigation helps, I've been up here many times telling you that mitigation works. So if mitigation works, and you instigate it and you initiate it earlier, you will probably have saved more lives. If you initiated it later, you probably would have lost more lives. You initiated at a certain time. That was taken as a way that maybe somehow something was at fault here. So let me tell you from my experience, and I can only speak from my own experience, is that we had been talking before any meetings that we had about the pros and the cons, the effectiveness or not of strong mitigations. So discussions were going on mostly among the medical people about what that would mean. The first and only time that Dr. Birx and I went in and formally made a recommendation to the president to actually have a, quote, shutdown in the sense of not really shutdown, but to really have strong mitigation. We discussed it. Obviously, there would be concern by some that, in fact, that might have some negative consequences. Nonetheless, the president listened to the recommendation and went to the mitigation. The next second time that I went with Dr. Birx into the president and said, 15 days are not enough. We need to go 30 days. Obviously, there were people who had a problem with that because of the potential secondary effects. Nonetheless, at that time, the president went with the health recommendations, and we extended it another 30 days. So I can only tell you what I know and what my recommendations were. But clearly, as happens all the time, there were interpretations of that response to a hypothetical question that I just thought it would be very nice for me to clarify because I didn't have the chance to clarify. Thank you.
The date on that. Excuse me, the date.
You know, to be honest with you, I don't even remember what the date was, but I can just tell you the first and only time that I went in and said we should do mitigation strongly, the response was, yes, we'll do it.
And what did he do? Is that the travel restrictions?
No, the travel restriction is separate. That was whether or not we wanted to go into a mitigation stage of 15 days of mitigation. The travel was another recommendation when we went in and said we probably should be doing that, and the answer was yes. And then another time was we should do it with Europe, and the answer was yes. And the next time we should do it with the UK, and the answer was yes.
In this interview, you said there was pushback.
Yeah.
Where did that pushback come from?
No, it wasn't, and that was the wrong choice of words. You know what it was? When people discuss, not necessarily in front of the president, when people discuss, they say, well, you know, this is going to have maybe a harmful effect on this or on that. So it was a poor choice of words. There wasn't anybody saying, no, you shouldn't do that.
Are you doing this voluntarily or did the
No,
president
I'm doing it.
advise you?
Everything I do is voluntarily, please. Don't even imply that.